Hello friends, today we are going to talk about hemochromatosis. We'll go through by definitions, symptoms, diagnosis, treatment, and the last one is complication. First we go through by definition. It is a hereditary disorder that causes iron overload. Iron overload in our tissues that causes liver damage, pancreas that mainly affect the islet cell, adrenal glands, and heart dysfunction. Heart dysfunction is causes restrictive cardiomyopathy, and the another one is, in this case, melanin will increase that causes bronze skin discoloration. After that, the hemochromatosis is divided into two parts. Primary and the secondary. Primary is caused by some gene defect. The first one is HFE gene, that defect on chromosome 6p, and the another one is HIV gene, that effect on chromosome 61. Both increase the iron absorption. Secondary hemochromatosis is mainly caused by the history of blood transfusion, like alpha thalassemia, alpha thalassemia is a defect of HP, that is a hemoglobin decreases in our blood, that causes iron deficiency. That's why we need to transfuse the blood. When we transfuse the blood, that will increase the iron overload in our tissues. And the another one is, some places they used to eat iron utensil, that causes in our body is iron overload. And the another one is secondary causes, is hemosiderin. When the RBC is breakdown, and that will convert into heme and the iron, that is called hemosiderin. And when the hemosiderin is excessive accumulate in our tissues, is called hemosiderosis. Hemosiderosis also causes secondary hemochromatosis. After that, we can go for symptoms. Symptoms is like HP axis dysfunction, hypothalamus pituitary axis dysfunction, that causes decrease gonadal hormones, and that causes hypogonadism. And the another one is the accumulate of crystal in joints, that causes arthropathy. They also cause some cardiac dysfunction, that is restrictive cardiomyopathy. That increase the mortality rate. After that, we can go for diagnosis. First, we can check the iron profile. Because there have excessive accumulation of iron, that will shows serum iron will increase, and percentage of transferrin saturation will also increase, and the serum ferritin will also increase, but total iron binding capacity will decrease. The another one for definitive diagnosis, we can go through by liver biopsy. Liver biopsy, we can use Prussian stain. Prussian blue stain test shows bluish violet granules. That will confirmatory diagnosis. After we make the diagnosis, we can go for treatment. Treatment, we can give some iron chelating agent. Like defroxamine. And the another for definitive treatment is phlebotomy. We can use some needles to puncture the small veins and we draw blood, and we can use phlebotomy per weekly. When the iron ferritin will become normal, we can use 2 to 4 months in once. The complication will be if the disease is not treated, and the patient will show some complication like cirrhosis, hepatocellular carcinoma, the another one is because of cardiac dysfunction, it will show restrictive cardiomyopathy. They also affect the pancreas. The mostly cell is a islet cell that will cause diabetes mellitus, and they also dysfunction of HPA dysfunction that will cause impotence. Please, if you want to more video like this, please subscribe my channel. This is a medical information video. Please, if you are taking medicine, please take the doctor advice. Thank you guys.